Intraosseus vascular access. This video will demonstrate how to establish intraosseous vascular access. This technique may be performed on both adult and pediatric patients using a variety of commercially available devices. To begin, the pre-hospital care provider assembles the equipment. This includes an intraosseous infusion needle, a syringe filled with at least 5 milliliters of sterile saline, antiseptic, intravenous fluid and tubing, and tape. Ensure proper body substance isolation by donning the proper level of personal protective equipment. Next, ensure that the patient is in a supine position. The choice of insertion site may be the anterior tibia or the sternum. The anterior tibia is used in both adult and pediatric patients. The sternum is used only in adult patients. For tibial insertion in adult patients, the insertion site is usually located at the anterior medial distal tibia or anterior medial proximal tibia. For pediatric patients, the insertion site is the anterior medial proximal tibia just below the tibial tuberosity. To obtain intraosseous vascular access, the provider identifies the insertion site and the landmarks. If the tibia is the insertion site, the lower extremity is stabilized by another provider as necessary. The insertion site area is cleansed with an antiseptic. The provider holds the needle at a 90-degree angle and inserts the needle through the skin and into the bone cortex. Depending upon the device, a circular motion will need to be performed. A pop will be felt upon entering the bone cortex. When a lack of resistance against the needle is felt, needle advancement is stopped. The provider releases and removes the trocar from the center of the needle. The provider attaches the syringe with saline to the needle hub. The syringe plunger is drawn back slightly, and the provider looks for fluid from the marrow cavity to mix with the saline. Dry taps are not uncommon with this procedure and may be due to a bone plug in the intraosseous needle. Next, the provider injects 5 milliliters of saline, observing for signs of infiltration. This infusion will also clear any bone plug that may be present. If there are no signs of infiltration, the provider removes the syringe from the needle hub, attaches the intravenous tubing, and sets the flow rate. Finally, the intraosseous needle and intravenous tubing are secured.